All right. Good morning, good afternoon, good evening. My name is Mohammed Ali Lutfi. I am a member of the Civil Society Committee Management. Every year, one day prior to the Conference of State Parties, we come together to hold the Civil Society Forum. This forum aims to highlight current issues that interest the disability movement and to realize the progress of the CRPD implementation. This year's forum will have 3 sessions. The first session will set the scene of this year's forum and will also share some research findings. The second session will discuss the increasing adaptation to digital world in light of the ongoing COVID-19 pandemic. And the third session will focus on living independently in the community within the context of COVID-19 pandemic as well. At this year's forum, international sign language interpretation is provided. Captions are available and can be displayed through your Zoom control panel by clicking the CC button. The link is also available in the chat box for CART. We are also providing Spanish and French interpretation, and you can access these channels by clicking on the global button or on your Zoom control panel. You can also ask questions to our speakers throughout using the chat box, and we will do our best to get through all of your questions. We will run a poll during the forum, regarding the upcoming Global Disability Summit. This poll will be available throughout the entire forum, and of course, it is going to be confidential. If you have any problems or questions, please, throughout the forum, please feel free to write to the forum's administrators. Now, allow me please to welcome our distinguished guests with us today. First, I would like to welcome Mr. Mark Lowcock, Undersecretary General of OCHA. Mr. Lowcock, floor is yours.
Mohammed, thank you very much indeed. Hello, everybody. I'm really pleased to be here with you today. Thank you for the invitation. The Civil Society Forum has been a really important champion of including people with disabilities in responses to humanitarian crises around the world. And that's incredibly important because historically, the needs of disabled people and their special requirements in crises have not been adequately dealt with. So thank you for all your work. I wanted to talk a bit about the pandemic. Obviously, everybody on the planet's been affected by the pandemic, but that includes 1 billion people in the world who have disabilities. And it's important to recognize their needs and requirements, and also to talk about how we can do a better job in meeting them. You all know that poverty and inequality has increased during the pandemic. Jobs have been lost. Children have lost access to education. We've seen an intensification of violence and abuse and stigmatization. And unfortunately, people with disabilities have been among the worst affected by all that. They have struggled often to get the right health services and treatment, including when they contracted COVID-19. And that's partly because of discrimination. A lot of specialist support services have not been sustained during the pandemic. According to the World Health Organization, in 2020, 22 countries reported a reduction of more than 1/4 in disability support services. I think that's probably just the tip of the iceberg. I think it was much worse than that. And that, of course, is against a context where only 1% of people with disabilities in the poorest countries, in the low-income countries, can access benefits at all. We tried to respond to this in the way humanitarian agencies planned their support for people during the pandemic, including in the Global Humanitarian Response Plan for COVID-19, which we launched in March last year. And immediate responses included, for example, ensuring people with disabilities got help despite physical distancing arrangements, that they were able, wherever possible, to access learning services, that there were specific facilities tailored to the needs of people with disabilities for things like hand washing and other sanitation services. And I think it's important to recognise that there was an effort made to do all these things in close consultation with people with disabilities. There was also additional best practice and policy guidelines produced for humanitarian agencies to enable them to understand how best to help people with disabilities. That builds on what happened in 2019 with the IASC Interagency Standing Committee new guidelines. I want to thank everybody in the International Disability Alliance for your contribution to that, because it certainly helped make the guidelines better than they would otherwise have been. We've also, across the UN last year, rolled out an accountability framework for our own UN-wide disability strategy, the things we're trying to do and how we'll be held accountable for whether we do them or not. And that has also contributed to what I've been trying to do in my office. We continually in OCHA trying to improve our planning and coordination tools so that we understand better what people with disabilities need in crises and can respond to them. We've also arranged for this to be better reflected in our funding. My office runs 19 country-based funds, and we've provided additional grants for people with disabilities through those funds. We also run the UN Central Emergency Response Fund, and we are going to be providing targeted tailor assistance in coordination with disabled people's own organizations in a next round of grants that we'll be providing from that fund. So I think we're making progress. I have to say, I wish we could make more progress faster. And here are a few things I think would help to do that. Firstly, this really should be standard practice, but it's not, so it bears repeating. We need to make sure we always consult people with disabilities and their representative organizations when we're looking at what humanitarian needs are, because when we do that, we know it delivers direct results. I was briefed recently about how, following consultations in Ukraine, the humanitarian fund there allocated money to provide home care and emergency assistance to 3,000 people with disabilities who might otherwise have been missed. The second thing we need to do is essentially, in the jargon, which I don't really like, but the jargon we use, mainstream humanitarian assistance to meet the needs of disabled people, not just in the pandemic, that we learn the lessons we've tried to apply in the pandemic and double down on that stronger focus on people with disabilities after the pandemic as well. Thirdly, and again, there's been some progress, but it's not adequate, we need still to get better at improving the data on people according to their particular needs, whether they're women and girls, whether they're older people, or whether they're people with disabilities. There's been some progress in that, but it needs to be a lot better. And one thing that we need to do, which is important, is recognize that sometimes people have multiple needs. So a woman with a disability might also be elderly, or she might also be displaced, and we need to take account of all those things. Lastly, and this is something that should be obvious, but if we did it better, would have a really dramatic effect. We need to give staff, people working for humanitarian agencies, particularly on the front line in crises, better training and guidance on what it means to include disability issues in their planning. And I hope that's one of the things that we'll really prioritize over the period ahead. As you said, well, some of you know, I'm shortly completing my tenure in this role. I'm passing on the mantle of Emergency Relief Coordinator to Martin Griffiths, and I'm sure that building on the initial steps we've taken over the last 4 years, he will really accelerate and make a lot more progress in meeting the needs of disabled people, including through their own organizations in humanitarian crises in future. And that will be good, not just for people with disabilities, but for everybody else as well. Thank you very much indeed, and good luck with your meeting.
Thank you, Mr. Lawcock, for your remarks and for the exciting and important work that OCHA is doing to supporting persons with disabilities during such critical time that we are going through its humanitarian operations. Thank you very much. Now, please allow me to welcome Ambassador Jukka Salovara, Permanent Representative of Finland to the United Nations. Your Excellency, floor is yours.
Thank you so much, and it's really good to speak after Mark, because this allows me to really thank him for his good work in including and mainstreaming sort of disabilities into the humanitarian effort. You've really done a great job with that. But dear participants of the Civil Society Forum, friends and experts, it is a great honor to address you today as the chair of the Conference of the States Parties to the Convention on the Rights of Persons with Disabilities, and give a good start to this important week with all of you. Civil society is an important partner on all different levels for us, and we are extremely concerned over the shrinking space for civil society around the world. For Finland, meaningful participation of organizations of persons with disabilities and other members of the civil society to the COSP is one of the national priorities during our presidency. We are looking at ways on how to make the most of the conference of persons with disabilities and for persons with disabilities. Your role is crucial. You are the experts who have the latest knowledge and information, the actors who actively work for the rights of persons with disabilities, and the watchdogs who oversee that states do their part in protecting, respecting, and fulfilling the rights of persons with disabilities everywhere. We have many important and timely discussions ahead of us this week. For the themes of the conference, the Bureau, consisting of Guatemala, Iraq, Poland, Zambia, and Finland, wanted to choose timely issues that all require our attention. The COVID-19 pandemic as an overarching theme felt like the only choice, as many countries are still heavily dealing with the impacts as well as a response to the pandemic. The COVID-19 pandemic has exposed deep-rooted structural discrimination globally. Emerging data indicates that persons with disabilities have been disproportionately affected by the pandemic, and COVID-19 responses have not addressed the discrimination faced by persons with disabilities. Many forms of intersecting discrimination remain largely invisible and unaddressed in the large-scale COVID-19 responses. Similarly, the discourse around the socio-economic impact of COVID-19 fails to address the rights and needs of persons with disabilities, especially those of women and girls. As for the roundtable discussions, our priority has been to address the rights of persons with disabilities in all three pillars of the work of the UN. Focusing on protecting the rights of persons with disabilities in armed conflict and humanitarian emergencies, and linking the COSP discussions to the Article 11 of the Convention is timely, as this is the second anniversary of Security Council Resolution 2475. We need to better understand how to interpret our international obligations and barriers hindering the fulfillment of rights of persons in armed conflicts and humanitarian emergencies. COVID-19 pandemic has also had a negative impact on independence of persons with disabilities. Persons with disabilities have the right to live independently, be a part of the community, and to be active participants in all spheres of society. They should be able to make their choices and have full control over their own lives. Hence, they should not be objects whose choices and decisions are made by someone else. Deinstitutionalizing and providing necessary services should be at the core of our discussions. In regards to the right to education, many have been forced to study behind their computer screen this year. Yet we need to remember that those were somewhat lucky if you had access to a screen and the screen was accessible to you. Accessibility of digital solutions is only one aspect of inclusive education, as there are many other barriers that children with disabilities face in access to education. Education needs to be inclusive and accessible for everyone and everywhere. Being able to receive an education is still a dream too far away for many. I hope this week will shed further light on how to realize the rights of persons with disabilities better in the future. This week feeds into the promise of the international community to leave no one behind. I wish you fruitful discussions and warmly welcome you to participate actively in the conference of the states parties this week. Your expertise, knowledge, and participation is highly valued. Thank you.
Your Excellency, thank you very much for your excellent remarks, and we always look to Finland and its historical role in supporting the rights of persons with disabilities, especially around this time of a humanitarian crisis. And we had the great example of late Kola Konkala, who was a great leader of our movement from Finland. Now, allow me please to welcome Kari Hug Jøsson from the government of Norway. Please, the floor is yours.
Thank you so much, and thank you for inviting me to the forum. I have been asked to talk a little bit about the Global Disability Summit, and so I will. And first, let me start by saying that, as we know, the pandemic has uncovered a need for action to ensure real inclusion at country level. And that is why Norway is particularly happy to host the second Global Disability Summit in February 2022. And we do this together with our partner, International Disability Alliance. We think that this gives us an opportunity to contribute to lasting change at country level. So this is a unique partnership we have, and a unique possibility to make a change. The first Global Disability Summit took place in London in 2018, and it was game-changing. And we have high ambitions also for the Oslo Summit. And unfortunately, due to the COVID-19, the summit will be, as you know, fully virtual. We would have loved to meet in real life, but at the same time, a virtual summit allows for broader participation, which is something that we welcome. And the summit in Oslo will build on the results achieved at the first summit, with the aim to further accelerate much needed progress towards the fulfillment of the rights of persons with disabilities all over the world. The summit will mobilize commitments and contribute to strengthen efforts for the implementation of the Convention of the Rights of Persons with Disabilities, the principle of leaving no one behind in order to reach the Sustainable Development Goals, and on building back better, or building forward, as some would call it, and more inclusive with regards to COVID-19. To obtain lasting change at country level, we seek collaboration with states, multilateral organizations, and not least civil society, and particularly with disabled persons' own organization. Access and meaningful participation are crucial for making lasting change possible. Together, we can take an important step towards real equality. And for that, All of us here today are partners, and we are happy to listen to your points of view and get your inputs. So thank you so much for inviting me again. Thank you.
Thank you, Carrie. And we are all looking forward to the Global Disability Summit, knowing in advance that the government in Norway is going to be a great host for such a great event. Thank you very much.
Thank
And
you.
please now allow me to welcome Mrs. Ana Lucia Arellano, the Chair of International Disability Alliance. Ana, the floor is yours.
Thank you very much, Mohammed. Good morning, Excellencies, ladies and gentlemen, colleagues and friends. Greetings from Quito, Ecuador, Latin America. It is my pleasure to address you here, and again, I do this virtually. I cannot believe it's been 2 years since we all gathered in person. While the past 2 years have flown by, there have also been periods of quietness, loneliness, and isolation for some of our constituencies. There have been some concerning trends in the advancement of persons with disabilities. I personally know that my board has been impacted, so I can only imagine the difficulties and barriers faced by other groups. Colleagues, I address you as the chair of the International Disability Alliance, IDA. We are a network of networks, a network of 8 global and 6 regional organizations of persons with disabilities and their families. Together, the members of the Alliance represent 1,100 national organizations of persons with disabilities, OPDs, otherwise, in more than 180 countries worldwide. We do indeed have some things to celebrate this year. We just heard from the government of Norway for their plans to host a Global Disability Summit in February 2022. And IDA is pleased to be joining as a co-host, and we will ensure a loud and active voice of organizations of persons with disabilities. We also heard the great work that UN OCHA is doing to ensure the rights of persons with disabilities that are respected in the humanitarian sphere. And we heard of the great work that the Bureau of the Conference of the States Parties is doing to protect our space at the conference. But our work is not done yet. We are very far from it. As I speak, our brothers and sisters across the world are still not receiving equal access to COVID-19 treatment, especially in the Latin American region, the most impacted region with COVID-19. The pandemic continues to reveal how, in face of a real crisis, the most marginalized and excluded are being re-excluded and re-marginalized. During this COVID-19 pandemic, persons with disabilities have been amongst the most neglected group. In many countries around the globe, we were first to lose our employment and income, and were among the last who received accessible information about the pandemic. The COVID-19 is also demonstrating the harmful and collateral effects of institutionalization. Why is this still happening in an era where we can all meet digitally like this? Why are we still not respecting the basic rights that were promised to us in the CRPD, the very treaty that member states sign up to? Therefore, we very much welcome this civil society forum and the discussions that you are going to have. This is our forum. Use this opportunity, dear friends. Make our voices heard about institutionalization. We know of the shocking reports of the increased rates of the spread of the COVID-19 virus in institutions and in segregated settings, how the virus spreads like wildfire in congregated settings, settings which undermine the CRPD. Yet, these places continue to exist. In fact, the pandemic, its recovery, is a good opportunity for us to seriously consider de-institutionalization, closing of institutions. There is no such thing as a good institution. And then we come to vaccine distribution. we call for persons with disabilities to have priority access to vaccination. We strongly request that the information on vaccinations should be accessible in plain format and that all vaccination venues are accessible. We already experience exclusion, discrimination, and neglect during the response of the pandemic. This should not be the case in dissemination of COVID-19 vaccination. Colleagues, as we work together to build back better and more inclusively, organizations of persons with disabilities, OPDs, have a critical role to play in contributing and shaping policies and programs of governments, the UN, and funding agencies. Participation of OPDs in decision-making is a must to avoid the mistakes of the past that have revealed dramatic and disproportionate impact at the onset of the pandemic. To monitor that OPD participation that is real and it's meaningful, it is my pleasure to announce the launch of the second IDA Global Survey on OPD participation on a new accessible online survey platform. This survey is a bit like the census of the disability rights movement to know how we are progressing with our Nothing About Us motto. The report from the first survey was instrumental in advising the development of guidelines on OPD engagement by the UN system. And as I speak, the link of the survey is being posted in the chat box. We encourage all OPD activists to take the second survey and disseminate widely in your networks. Colleagues, I wish you the best during today's deliberations. Make your voices loud, make them clear, and never stop. Thank you very much.
Thank you, Anna. Thank you very much for these very inspiring remarks and for reminding us about the impact of the COVID-19 pandemic on our brothers and sisters around the world and the role that we are supposed to do as a global disability movement alongside with the United Nations and other agencies. And we look forward also to the role of the leadership of IDAS during the Global Disability Summit. Thank you very much. Last but not least, I would like to welcome Mr. Andrew Parsons, Chair of International Paralympic Committee. Mr. Parsons, the floor is yours.
Thank you very much. Hello, everyone. Firstly, I would like to thank the Civil Society Forum for the opportunity to speak today. At the International Paralympic Committee, our vision is to make for a more inclusive world through sport, through parasport. We want to achieve this by organizing fantastic sport and by using the growing global interest and impact of our events as a vehicle to advance the rights of persons with disabilities around the world. We also believe in the power of partnerships and the understanding that by working together, we can achieve much, much more. Today, I am delighted to tell you about We the 15, a new platform bringing together the biggest coalition ever of international organizations from the world of sport, human rights, policy, communications, business, and entertainment. Our plan? To accelerate change over the next decade for the planet's 1 billion persons with disabilities who make up 15% of the global population. We the 15 is spearheaded by the International Paralympic Committee and the International Disability Alliance, and is the biggest ever human rights movement to end discrimination towards persons with disabilities and transform the lives of more than 1 billion people. For the first time in history, the global governing bodies of all 4 major sport organizations for persons with disabilities, the IPC, Special Olympics, Invictus Games Foundation, and the International Committee of Sports for the Deaf, ICSD, are uniting to initiate change for the world's largest marginalized group. We will use the platform of our major events to harness sports' unique ability to create positive societal change. Aligned with the Kazan Action Plan, we will develop indicators for sports' contribution to the Sustainable Development Goals. Importantly, our athletes will give persons with disabilities a much needed voice at a time when it's needed the most. Joining us in this journey are an increasing number of DPOs and NGOs, including UN Human Rights, World Health Organization, UNESCO, World Bank, UN SDG Action Campaign, the Valuable 500, Global Citizen, UN Alliance of Civilizations, for example. To date, 20 organizations have joined the platform, all sharing their knowledge and experiences to make a difference. With COVID-19 disproportionately impacting persons with disability, now is the time to act. As the world aims to build back better post-pandemic, we must align everyone with the 2030 agenda of the United Nations and ensure we do not leave 1 billion people behind. We the 15 will shine a light on 15% of the world's population. It will build greater knowledge of the barriers and discrimination persons with disabilities face on a daily basis at all levels of society. By doing so, our objective will be to break down these barriers so all persons with disabilities can fulfill their potential and be active and visible members of an inclusive society. We the 15 will change attitudes and create greater opportunities. At a time when so much progress has been made in terms of gender, ethnicity, sexual orientation, we the 15 will place persons with disabilities at the heart of the diversity and inclusion agenda. We want We the 15 to be a global movement that the world's 1 billion people can rally behind, a movement that over the next decade is publicly campaigning for disability visibility, inclusion, and accessibility. When we launch on August the 19th, 5 days before the Tokyo 2020 Paralympic Games, the campaign will have many different innovative elements. This will include a new symbol and color that we hope the world's 15% with disabilities will embrace. We also have a stunning 90-second long campaign film underlining the CRPD social model of disabilities. With the support of our broadcast right holders, commercial supporters, and partner organizations, we aim to reach at least 500 million people with this film within 1 week of its launch. Tokyo 2020 will be watched by a cumulative 4.25 billion people in more than 160 nations. You will see and learn more about We the 15 during the opening and closing ceremonies, while each of the 4,300 participating athletes will be a We the 15 ambassador, talking to the media about why this campaign is needed now more than ever. Tokyo 2020 is just the starting point. The organizing committees of Beijing 2022, Paris 2024, Milano Cortina 2026, and LA 28 Paralympic Games are all on board and looking at how they can engage global audiences in these long overdue conversations. Special Olympics, Invictus Games Foundation, and the ICSD are also doing the same with their future events. Tomorrow at 8:30 Eastern Time, we are hosting a side event where you can learn more from the people involved in the We the 15 and how you can support our ambitions to transform the lives of the world's 1 billion persons with disability. Today, we kindly ask you for your support of the We the 15 movement, so together we can make the world more inclusive for all. Every single person on this planet, with and without disabilities, can make a difference by considering how their actions are impacting change. At International Paralympic Committee, we believe that change starts with sport, but with the We the 15 change can start in every community. Change can start with you. Thank you very much. Over back to you, Mohammed.
Thank you, Mr. Parson, for your intervention, and we are all looking forward to watching the event you're holding. And we all appreciate the role of sports in promoting inclusion, of course. Well, it's our time now to close the opening session, and I wish you all a successful forum and also a very exciting week ahead of us at the Conference of State Parties, and I'll look forward to seeing you all again soon. Thank you very much. And now I would like to pass off to my colleague, Mr. Dominic Haslam, the moderator of the first session of the forum this morning. Thank you very much.
Thank you, Mohammed. And firstly, thank you to you for moderating the first session and to all of our opening speakers. Really interesting start to the forum. It's a shame we can't all be together, but maybe this is the next best thing. So as Mohammed said, I'm Dom Haslam. I'm the chair of the International Disability and Development Consortium, which is a network of NGOs and DPOs working on inclusive development around the world. Just a reminder that international sign interpretation is provided and captions are available and can be displayed through your Zoom control panel by clicking the CC button. The link is also available in the chat for CARD. As previously explained, Spanish and French interpretation is also available, and you can access these channels by clicking on the global button on your Zoom control panel. If you have any questions on any of these, please write in the chat box to the administrator. This second session is focused on presenting the research being conducted on the impacts of the COVID-19 pandemic, and in particular, what OPDs are working on. We're also going to be launching 2 polls, which will pop up on your Zoom screen, so you can respond to these. And I'll be asking a couple of questions, which you can respond to by typing in the chat box. I won't repeat the statements made already in this forum, except to wholeheartedly support them and the overall message that the pandemic has made more clear than ever, perhaps, the discrimination and exclusion faced by persons with disabilities across the globe, a situation that we cannot allow to continue. We have many speakers to hear from in this session, however, so I am going to pass on straight away to the first of these, covering 2 research updates. So I'm delighted to hand back initially to Mohammed Ali Lutfi, who will speak on the work of the stakeholder group of persons with disabilities. Mohammed, this time as a speaker, the floor is yours.
Thank you, Dominic. Thank you very much, everyone. Again, my name is Mohammed Ali Lutfi. I'm the co-chair of the stakeholder group of persons with disabilities to the high-level political forum on the SDGs. And I'm so happy to be with you here to share the findings of 2 research we did as a stakeholder group. In response to the COVID-19 pandemic, the stakeholder group of persons with disabilities carried out 2 phases of qualitative research to gather information on the experiences of persons with disabilities in the context of the COVID-19 pandemic and to complement existing research studies. The first phase of the research was carried out in May and June 2020 with 93 leaders from the disability movement. Data were gathered around thematic units related to the pandemic and the Sustainable Development Goals. Methods to gather data included online interviews, focus groups, and surveys with the disability movement around the world. The key findings of phase 1 of the research indicated that most persons with disabilities around the world have been adversely affected by the pandemic with additional or new barriers, including in the reopening phase. The first common barrier that emerged from the research included 1, lack of access to information on COVID-19 for all persons with disabilities, 2, barriers in receiving social protection measures and employment, and 3, lack of disability inclusion in COVID-19 response and recovery efforts. Additionally, 3 recurrent themes emerged from the research. 1, the role of organizations of persons with disabilities providing services instead of governments, lack of access to healthcare facilities, and 3, lack of disability data. The second phase of the research was carried by local and regional researchers in Bangladesh, Bolivia, and Nigeria from February to April 2021. Data were gathered around thematic units related to the pandemic and the SDGs similar to phase 1, but also included access to vaccines. Methods to gather data included document analysis and key informant interviews with underrepresented persons with disabilities from different locations to gain in-depth views based on the local perspective. The interviews were carried out in the local languages, including the national sign languages, and in persons or online, depending on the country context and COVID-19 pandemic rules. All three studies indicated that the most significant barriers were: one, lack of employment and social protection; two, inaccessible healthcare facilities; three, lack of access to COVID-19 information and data; and four, lack of accessibility in general. Additionally, overlapping themes emerged, including: one, new barriers due to the changing roles in extended family situations; two, increased competition to find employment with overall high unemployment in society; three, lack of financial and technical resources to access information via phone or internet; and four, increased lack of security and safety. In closing, findings of both phases of this research can be used to highlight gaps and barriers and to remind governments, the United Nations system, civil society, and other stakeholders that persons with disabilities and their representative organizations are being left behind more than ever and must have active roles in all phases of COVID-19 response and recovery efforts. Thank you very much.
Thank you, Mohammed, and very much appreciate the amount of work that you're trying to summarize in a very short brief. So I'm sure we'll be able to make those research reports available for others to go through the detail. Thank you. Next, I'm going to pass on to Angelique Hardy, who's the coordinator of the International Disability and Development Consortium, or IDDC, who will speak on both the work of the Disability Rights Monitor and IDDC's own report. Angelique, over to you. The floor is yours.
Thank you. Good day to you all. So I will start chronologically with the COVID-19 Disability Rights Monitor, which is an initiative that has been launched by 7 disability rights organizations, including IDA and IDDC, in April 2020. The goal of this initiative was to collect data on the rights of persons with disabilities following the COVID-19 breakout. The thousands worldwide testimonies collected demonstrated that, unfortunately, countries failed to adopt disability inclusive responses, regardless of their level of economic development. The DRM highlighted, in particular, 4 major findings. First, that residential institutions became hotspots and failed to protect the persons living there. Second, that rigid lockdowns caused a breakdown in essential services in the community. Third, that underrepresented populations of persons with disabilities suffered serious and multiple human rights violations. And fourth, that persons with disabilities were denied basic and emergency health care. In 2021, further to its DRM work, IDDC also analyzed the impact of COVID-19 on civil society organizations with the support of the UNPRPD. We looked at how IDDC members and their partners adapted and are still adapting to challenges posed by the pandemic. It was crucial for us to look at the lessons we could learn from their experience to ensure that future shocks and crises would not come again at the expenses of persons with disabilities. Among our recommendations, we call on national, regional, and local authorities, as well as international organizations, to first ensure, of course, that COVID-19 vaccinations are available to persons with disabilities. Second, to engage meaningfully with CSOs. We noticed that civil society organizations, when they were able to engage with national and local authorities, as well as international organizations, then the activities supporting persons with disabilities have been facilitated and even help mitigating, at least to a certain extent, the impact of the pandemic. We also call on those authorities to involve persons with disabilities and OPDs in the design and implementation of any public policies and programs, not just those targeting specifically disability. And a fourth recommendation is also for organizations and authorities to evaluate honestly their COVID-19 responses, the shortcomings, and also the good experiences, to be better prepared for future similar situations and not be taken off guard. This is for us how we will build back inclusively. I will stop here, but I invite you to join our IDDC Inclusive Futures side event on Wednesday, where we will share actually the latest research updates in further details. And the report I mentioned for IDDC will be published on Wednesday, and that will be launched during this event. Thank you very much.
Thank you very much, Angelique. Thank you. So we're going to break from the speakers just for a moment, just to raise the first open question to all of you, to our participants and listeners from around the world. As you may have already known, but also as you've heard today, the government of Norway and the International Disability Alliance are organising a follow-up to the Global Disability Summit that took place a couple of years ago in the UK. Could you please let us know what themes you would like to be included specifically in the Global Disability Youth Summit that will be part of that? So just to repeat, themes that you would like to be covered in a Global Disability Youth focused summit. And if you could please type your answers in the chat box, you'll see the question has also been raised in the chat box as well. Thank you very much. In the interest of time, I'm going to pass straight on to our next couple of speakers. And this session focuses on country-specific research. So firstly, I'm very pleased to pass on to Jenny Rosa Damienti, who will speak on the Transforming Communities for Inclusion project. Jenny, please, the floor is yours.
Thank you very much. Good morning, Excellencies. Greeting from Indonesia. During COVID-19 pandemic, we discovered the problem faced by people with disabilities in Indonesia. The first, of course, the problem of the loss of livelihood for people with disabilities. It should be remembered that people with disabilities are already very vulnerable from the start. In terms of work, for example, of the few people with disabilities who work, most work in the informal sector, where there is no security whatsoever, basically works hand to mouth. Once this work cannot be done due to COVID-19, the person with disability is in a very difficult position. Indonesia does not have any unemployment benefit or disability benefit that left people with disabilities in a very difficult condition, and they are completely dependent on the mercy of their families. Second, we found the difficulties of accessing social protection programs that stems from the problem of data collection. The data was collected by Ministry of Social Affairs by 2021 record only 200 people with disabilities by name and address, while the estimated number of people with disabilities in Indonesia, according to the National Social Economic Survey, is 10.65% of the total population, or almost about 29 million people. 200 people are recorded by name, by address, but in fact, we have 29 people with disabilities in Indonesia. So the gap in the data is so huge. Third, there is no specific social protection program for persons with disabilities. Almost all social protection programs in Indonesia are poverty-based and family-based. Many people with disabilities are individually very poor and have no income at all. So they are forced to live with their families, even distant families. If the family where they are staying does not fall into the criteria of being poor, then all family members, including the person with disabilities, will not benefit from social protection programs whatsoever. And the following problems that we found is the lack of involvement or not involving person with disabilities in the planning of COVID-19 response programs, except after very strong advocacy effort from organization of people with disabilities in Indonesia. OPD Indonesia during COVID-19 pandemic carry out their own activities to deal with the pandemic and conducting fierce advocacy to the government. For example, jointly conducting a survey on the impact of COVID-19 on persons with disabilities, trying our best to ensure that the person with disabilities are not left behind in social protection program, and advocating to the Ministry of Health to give priority to vaccination for persons with disabilities. Without our effort of fierce advocacy, the government just left us behind. And the last but cannot be left big problem is the negligence of people with disabilities who live in the institution, especially people with psychosocial disabilities. They are left behind from various COVID responses, ranging from information, health protocols, improvement of living conditions, and social assistance program. People who live in the institution in Indonesia do not receive any information about COVID-19, its effect, how to safeguard from that, including any access to news and social media platform. They do not have any COVID-19 prevention protocol, including implementation of physical distancing. As a result, COVID-19 cases exploded in various psychosocial institutions in Indonesia. So the explosion of COVID-19 cases in various institutions around the world should be a warning to everyone that the system cannot be long be maintained, and that the system of the institution should be abandoned. Thank you very much, Your Excellency.
Thank you very much, Jenny. Thank you for that really interesting work. And just a reminder to all speakers on behalf of the many translators we have working with us today to try and keep a moderate speed when speaking. I know it's difficult when we all have so much to say and you have such a short time, but it will be very much appreciated. And just with that note, I'd like to introduce Oh-Young Kweon, who will speak on behalf of the Korean Alliance for Mobilizing Inclusion of People with Psychosocial Disabilities. Oh-Young, please, over to you. Oh-Young, I'm afraid we cannot hear you. Would you mind coming off mute?
Okay.
That's perfect. Thank you.
Yes, I'm sorry. Thank you for inviting. Hello, everyone. In February 2020, when COVID-19 pandemic affected those people hospitalized in mental hospitals for long years, were the first and most damaged victims in South Korea. At the first stage, within 2 months from the first infection case, 115 from the 263 dead persons by COVID-19 were mental hospital patients. All 103 mental patients in across the world of Cheongdo Daenam Hospital and 196 patients of the second Miju Mental Hospital were infected by the coronavirus. 116 of the virus-infected mental patients of the two hospitals, 299 infected patients had been hospitalized more than 3,000 days, which is 8 years and 2 months. The first dead person in his 60s had been hospitalized for 20 years, and his first going out from the same mental hospital was for cremation after death. When the health ministry decided cohort quarantine of all infected 103 patients of Cheongdo Daenam Mental Hospital, the same across the world, only with supplying food and water without no life-saving treatment, Kami made a statement asking the ministry to do urgent actions to treat and save the remaining patients' lives after 6 had been dead in 1 week. It was 25 February 2020. Next day, 12 DPOs followed. And then the health ministry canceled the cohort quarantine on 27 February. The remaining patients could be moved to other general hospitals and save their lives. The advocacy was successful. Made in Asia reported Kami's statement with English translation, which was followed by the statement COVID-19 and persons with psychosocial disabilities. The document was published on 26 March 2020 by all global and regional networks and groups of the persons with psychosocial disabilities, users, survivors of psychiatry. By the COVID-19 pandemic, we learned people with psychosocial disabilities may be at increased risk of contracting coronavirus as a result of being placed and deprived of their liberty in psychiatric units and institutions and discrimination in accessing effective health services. Nevertheless, the budget spending for the mental hospital services grew 5 times in 10 years from 2009, and it became $7.7 billion in 1 year. Even though the budget for hospital services grew rapidly, community-based services that respond to the needs of persons with psychosocial disabilities and respect people's autonomy, choices, dignity, and privacy, including peer support and other alternatives to the conventional mental health services, could not be developed because the mental health budget rewards only for the medical or health services, not for those social or support services, even though effective and complying with CRPD principles. However, persons with psychosocial disabilities were not invited and left out from the new bill of supporting deinstitutionalization of the persons with disabilities in institutions, which was initiated by the National Assembly member with disability and DPOs of Korea, and which doesn't include those persons staying in the mental hospital and institutions. CAMI needs international support for inclusion of psychiatric institutions in the deinstitutionalization bill, repair of the mental health compulsory treatment detention laws, and increasing community support and services based on CRPD. Thank you so much.
Thank you so much, Erum. Thank you. We now have the second open question that I promised, which also covers the Global Disability Summit. So please do input in the chat box any ideas you have for themes and issues we should cover specifically in the Civil Society Forum, which we'll be organising in advance of the Global Disability Summit in 2022. I know many of you will have taken part in the first Civil Society Forum, which really set a great foundation for the summit itself. So we look forward to your ideas in the chat box on that. Thank you. Our final set of speakers for this session will focus specifically on the issues of vaccines. Firstly, very happy to introduce Elham Yousefian of the International Disability Alliance. Elham, with no further ado, over to you.
Thank you very much, Dom. I hope everybody can hear me and see me well. Good morning, good afternoon, good evening, everybody. I'm so honored to be with you today and talk about, I think, one of the most urgent challenges and priorities of disability rights movement at the moment, which is ensuring access to COVID-19 vaccination for all persons with disabilities at earliest possible. We now, I think all of us agree that the only solution, the only ultimate solution to the pandemic is access to vaccination. So there is no doubt that there's no way out of this situation but to access to quality vaccine in short amount of time for the strong majority of the population so that we can control this pandemic. And with new variations, it's now obvious that it's not going to be just one shot. We are going to be dealing with the situation of vaccination for many years. As they are already talking about second dose or recharging for those who have already received the vaccination. So I think the topic of vaccination, and you would agree with me, is going to be on the top of our list for years. And the reality of our world is that it's going to be the case, unfortunately. But it means that we need to think about how we can make sure that people with disabilities can get vaccination not after others, but before others. Just for one basic argument, which is we are at higher risks for many reasons, not just because of the health-related risks, but also because of the social, economic limitations and restrictions, barriers that persons with disabilities face in accessing healthcare service protection and information. We are at higher risk of contracting COVID-19, and we are at higher risk of developing more serious symptoms and less possible to access healthcare services. So for all these reasons, if persons with disabilities are not first in the queue of accessing vaccination, unfortunately, it would be very likely that they will be the last. But in terms of what we need to do, the International Disability Alliance and the International Disability and Development Consortium have launched together a campaign and have worked on different aspects of it. We have been working with our colleagues and partners in the World Health Organization and UNICEF to ensure that the briefing that they have produced on access to vaccination is as close as possible to what we believe the disability community really needs. And we are grateful to say that the final document is close to what we wanted, not 100% exactly what we requested for, but very strong document which can be really helpful in terms of ensuring access to vaccination. So we believe that in order to make sure that persons with disabilities are not left behind in accessing vaccination, a few layers of work needs to be done. First of all, global messaging around access to vaccination should be disability inclusive. Second, we need to make sure that we all talk about access to vaccination for low and middle income countries. And the reality is that any step taken to ensure that low and middle income countries access to vaccination would mean that people with disabilities are more likely to access vaccination, because the strong majority of persons with disabilities live in these countries. So we support any action to ensure that low and middle income countries have access to vaccination. In addition to that, we advocate for disability inclusive national vaccination plans, policies, and programs. And that means that priority should be given to persons with disabilities and their support network. And I want to emphasize on the support network, because without the support network, it's not going to be possible full immunity for the persons with disabilities, and they're not going to be able to access the services that they require. Then, of course, we advocate for information. And I want to emphasize on this point especially because recently we hear about how misinformation is spreading around and how many people in this world are not willing to get the vaccination just because of the misinformation that they receive. And I have to tell you that unfortunately, because of accessibility barriers, persons with disabilities are very likely to be influenced by the misinformation, because they rely on informal network. They have mostly in most situations they receive information from secondhand, because they are relying on ear-to-ear information passing. So it is important that any campaign against misinformation is inclusive of and accessible for persons with disabilities. Otherwise, even the best policy and programs will not reach the ultimate goal of including persons with disabilities simply because they are influenced by misinformation. So I can't emphasize this more, and I hope that colleagues that we have around the table today, colleagues from the civil society, disability organizations of persons with disabilities, government representatives, at their role, they make sure to take any measure they can to ensure that this misinformation, campaigns against misinformation, reaches persons with disabilities. The information about how vaccines are safe is provided in inclusive and accessible formats. So I'm conscious of time, and I know we have a full package of interesting speeches coming up in next session. So I want to thank you again for this opportunity and hope to see people with disabilities being vaccinated as quickly, accessibly, and inclusively as possible. Thank you so much, Dominic. Back to you.
Thanks very much, Ilham. Thank you. And I know, having worked closely with you on this, just how much progress we've made over the last year on some of the messages coming out, and I agree very much with you that it's about then translating those messages into action and into change in terms of people's access to vaccines. I couldn't agree with you more. finally, in this session, I'm really delighted to pass over to Sarah Kamau, who'd be speaking on behalf of the United Disabled People of Kenya. Sarah, please, over to you. The floor is yours.
Thank you, Dom. And hello, everyone. Hello, Your Excellencies. My name is Sarah, as you've heard, from Kenya, representing the United Disabled Persons of Kenya organization, which is an umbrella body of 4 persons with disabilities. And its mandate is to advocate for inclusion of rights of persons with disabilities in policies, programs, and plans by the government. So in Kenya, as far as the COVID vaccinations are concerned, there was a call by government to put a program in place and was launched on 4th of March 2021 by the president. He assured the nation that the vaccine would be given indiscriminately. The rollout program was meant to prioritize health workers, teachers, security personnel, and the vulnerable groups. However, there was no reference to persons with disabilities as a vulnerable group that needed specific consideration during the rollout that was done. The United Disabled Persons of Kenya, together with Caucus on Disability Rights Advocacy, made an appeal to the government through the Principal Secretary in the Ministry of Health for the consideration of prioritizing vaccination of persons with disabilities, to reach out particularly to persons with intellectual disabilities and high support needs, persons living in congregate settings, older persons, and persons with health conditions that put them at higher risk. This request to the government asked for health information campaigns and vaccine delivery sites to be made accessible and more inclusive for persons with disabilities by providing information in all accessible formats. The call was also to advocate for organizations for persons with disabilities to be meaningfully involved in the development of COVID-19 related planning and policy making, and that vaccinations must only happen with free and informed consent to persons with especially psychosocial impairments. There was also a call to government by the United Disabled Peoples of Kenya to make data available on how many people with disability were being vaccinated. The outcome was that the media televised briefings on COVID-19, and they started including sign language interpretation, which was not there before. Then there was community-based services and crisis counseling programs that continued in the local levels, and a text-only service for counseling services for persons who are deaf was also launched. An SMS platform, a WhatsApp group, and an online awareness session where members were supported on how to lobby and advocate for their needs within county COVID-19 support committees were established, because we have national governments and county governments. So persons with disabilities and their representative organizations were consulted because of this call and lobby by the organization. Government also rolled out a dedicated social protection program for 3 months only for about $20, an addition to the already existing cash transfer program which the country has to enable persons with disabilities be able to meet some of their needs. The organization also worked with the government and the non-governmental organizations to collect data on experiences for persons with disabilities during the pandemic. The findings enabled the organization to advocate for from an informed point of view, because it was found out that not many persons with disabilities were able to access information about COVID-19. The government during the time also has prioritized mental health issues and interventions because of the impacts of the pandemic. Not without challenges, the research findings show that social protection measures need to be increased, and that More cash is needed, and it is yet to reach out to the most needy on the ground. There's also the challenge of the data that is not disaggregated, and we therefore cannot exactly say how many persons with disabilities have received the vaccination, and this needs to be done. Although persons with disabilities got some COVID assistance within the counties, it was not enough and it could not reach all the needy people who required it. And so we are calling still upon the government to make sure that this support and fund is availed to everyone who needs it direly. Thank you so much.
Thank you so much, Sarah, for updating us all on the changes that have happened as a result of UDPK's work on the back of that powerful statement that that you released, I think, earlier on this year. So thank you very much for that. I'd like to thank all speakers for this session. I think by the engagement I've seen in the chat box, the content and the questions that have been raised, I hope it'll inspire some good potential future conversations and sessions, even at the Global Disability Summit next year. Just in very brief closing, because we're out of time now, I've heard many times over the last 12 to 18 months, the pandemic being described as shining a light on the lived experience of people with disabilities even before the pandemic. For me personally, COVID shouldn't be a spotlight or a lighthouse. It should be the match that lights the fuse, because we know beyond any doubt that without fundamental change in the way that health, education and social support systems are planned, designed and resourced, this discrimination will happen again. It won't wait for a pandemic. It will slip back into everyday reality. On that note, I'm now going to pass to Gagan Chabra from the Atlas Alliance, who will be monitoring session 2, entitled Our Communities Online, How Are We Adapting to This Online World? Gagan, please, over to you. Thank you.
Thank you so much to all the diverse and experienced speakers for sharing thought-provoking perspectives on structural discrimination, lack of social protection, and the access to vaccination programs. Thanks also, Dominic, for this wonderful summation point, which you mentioned about how vulnerability gets multiplied for persons with disabilities during these COVID times. Welcome to one and all. I'm sending across my warmest greetings from drizzly Oslo. My name is Gagan Chabra. I am the head of project inclusion at the Atlas Alliance. Atlas is one of the largest foundations working on the theme of disability inclusion, international development in developing countries from Norway. I'm quite elated to be the session's moderator. And before I talk a little bit about the session, first, let me talk a little bit about myself. I'm almost blind. I'm wearing a gray button-up shirt and black jacket. I have long curly hair. And in this session, we will touch on themes such as community inclusion, employment inclusion, digital divide, and inclusive education. And we have eclectic, experienced speakers from Ecuador, United States, Norway, and India. So it's going to be an enlightening session. But before we go into that session, a few notes concerning housekeeping, which need to be reiterated. We have sign language interpreters available. Also, we have closed captioning. If you want to access that, you can click on the CC button in the bottom of the panel, control panel. We also have interpretation into French and Spanish. You can click on the globe button, which is there in the bottom panel of Zoom. In addition, if you have any questions, you could write to us, the administrators, in the chat box. We want to hear your questions, so any questions from your end are much appreciated. Also, we will be running 2 polls, which will pop up on your screen during the course of the session. So please participate in them. We would also encourage you to ask questions, and hopefully we will get a chance to pose them to the eclectic group of speakers. So without any further ado, I would like to invite Sonia from Ecuador to talk about her introductory remarks, and specifically how do disabled communities, Sonia, specifically deafblind community, coping with and adapting to the COVID pandemic crisis, since we are finding ourselves in this increasingly online, socially distanced world? How are these communities coping with and adapting to the barriers which COVID-19 is raising? Sonia, the floor is yours.
Muy buenos días. Soy Sonia Margarita y agradezco mucho la invitación hecha por...
Good morning, I'm Sonia Margarita. I'm very glad to be here with you. I'm representative of the World Federation of Blind and Deaf People. In my communities, these people have problems to adapt to the new situation and the new normality. We have a specific way of communication. It depends on the person, and it's very complicated to communicate with the rest of people. Our disability is unique, and it involves both means, and this means sight and ear. And it becomes very complicated to communicate. We tried to help each other, but it's very difficult, especially when using Zoom meetings or any of this software, because we need interpretation and it's not always available for us. So if it's international, we need English interpretation. And here in our countries, in Latin America or in Africa or in Asia, it's not always the case. We don't always have interpretation services. Apart from that, we need also interpretation for our own languages. As you saw, because it helps us with communication. It gets complicated. Barriers and social distancing avoid these situations, and we are left behind. Young people quit school, elderly people stopped working because we have to do it virtually, and we need 24 hours interpreters. There are no funds for that. Governments don't give money to poor countries. We don't get help, and these services are very expensive. This involved we stay behind. We try to do our best. Technology goes faster than we can cope with all these devices. We don't have a specific program for us, like Zoom. And so we are left behind. Apart from that, these devices are very difficult to get for us because this special technology is very complicated and very expensive, and our economies doesn't allow us to buy them. As I said, we try to do our best with family and friends. We collaborate together, and this is our situation. I hope you can help us in order to continue with inclusive education, labor inclusion, in order to have a normal life. Thank you very much.
Thank you so much, Sonia, for underscoring the point about inclusive education, labor market inclusion, and fulfilling meaningful life. That's so important to underscore. Thanks for the perspective. I really appreciate it. Now, the next speaker is Jenny from Microsoft. Jenny, the question for you to reflect upon is, what are the barriers and opportunities for the employment inclusion of persons with disabilities in the digital labor market? We are seeing a lot of the platforms which are coming up. They are not perhaps as inclusive as they could be for people with disabilities. What are your reflections on that? Thank you.
Thank you, Guyan, and thank you for the honor of being here today. I'm Jenny Lake-Fleury. I'm the Chief Accessibility Officer at Microsoft, and my job is really to work on inclusion of people with disabilities, really to power us as a company, but also to power the world And for us, selfishly, as an employer of 150,000 people, is to make sure that we have the talent within our company to help us to build more accessible and inclusive products. I think this last year has shed an enormous light on the importance of disability inclusion practices and the importance of accessibility. I think it was an incredible forcing function. And I think for us, it's definitely driven us to accelerate a lot of things. We, in the last year, have pushed out global central accommodation, so meaning that anyone that's working for Microsoft with a disability that needs an accommodation can get such without cost, seen by them or their manager. So just simple but amazingly important things. We've expanded our hiring programs. We're seeing far more people and far more talent with disabilities out of work and being put out of work because of this environment that we are living in right now. And so actually we took our autism hiring program, which we've been running since 2015, and expanded it to the entirety of neurodiversity, and made sure that all of our processes really are catering and putting disability first, and making it easy for someone to self-identify as a disability coming in. But I think really, as we look at this economy and we look at what the future is for people with disabilities, and I'm incredibly humbled when I listen to Sonia and I listen to the previous conversations, there are definitely barriers in place. And we saw that very quickly with the pandemic. The pandemic pretty instantly drove a heavy demand on very simple things. We have automated captioning in most of our products. And the use of that automated caption in Microsoft Teams grew 30x pretty much overnight. And we also saw a lot of demand into our Disability Answer Desk, which is our free support for customers with disabilities around the world. And I think that's really prompted us to have a serious level of investment in how we can make it easier for people to get access to technology. I think that's a core construct that the industry needs right now, and making it easier to identify how to use some of the technology that does make it easier to do things like what I'm doing here this morning, and many are doing during this event. And so I think, some things for us, I think, be looking for those best practices and be taking them and using them and implementing them into your world. If actually you attend any of our Microsoft events, you'll see that we have audio descriptions, closed captioning, and sign language right there on the taskbar of our events now. There's no additional that you need to do. You just have to hit the button to request it. We've also been adding a lot of content via our partner at LinkedIn to drive, in fact, some dedicated training programs. And so I think it really is about how can you educate, how can you drive awareness, how can you make everything accessible by design, Gagan. I think that's really the core, is how can we make things more accessible by design? That has to be the industry standard.
That's such an important perspective, Jenny, and I cannot be more thankful for you to underscore, accentuate, and place that up and center accessibility by design, and not going back and fixing the accessibility features. So like the previous session, which Dominic was organizing and moderating, I want to ask an open question to all the participants around the globe. You might have heard or you might have followed that Norway, the Norwegian government, and IDA are organizing the GDS, the Global Disability Summit, which is happening in February 2022. And prior to this summit, we are planning to organize a civil society forum. So what would be your expectations from this civil society forum? What kind of outcomes would you want the civil society forum to bring forward to the GDS? And if you are anywhere around the globe right now listening to this question, you could write back straight to us in the chat box, and we would really appreciate your input. And now, since we have moved from Ecuador to United States, from the global south to the global north, again, we take a trip down to the global south, developing country, India. Dipendra, I would like to invite you to reflect upon the question of digital divide. What is the influence of digital divide on the full participation and realization of rights for persons with disabilities in especially developing countries, which do not necessarily have large amount of resources? Dipendra, the floor is yours.
Thank you so much, Gagan, for having me here, and for Ida for having me here and for this question. In the low-income group countries, you know, we are talking about ICT infrastructure, and there are so many gaps in current ICT infrastructure which are you know, getting highlighted, especially in this COVID pandemic time, because a lot of things have gone online, and the access to online resources is such a big key factor in being able to continue with our livelihood or our education programs. One key answers which has been said with my previous speaker that ended is obviously the standards, the international standards that come through. So as part of the, as Director Developing Countries Program in DAISY Consortium, one of our key objectives is to develop these standards, especially for the information access and e-documents and etc. The major challenge that we face in developing countries is that there is a huge digital divide, and the capacities to implement these standards, the solutions of access to information is not in isolation. It is a holistic solution, which means that the information creation to information dissemination and the tools in the hands of users all need to be accessible, and these need to be provided along with training to the users. The DAISY Consortium actually does acknowledge the role of this holistic solution, and we try to build capacity in the low and the middle income group countries by working on bringing all stakeholders together, by getting the strategy, identifying gaps, and then sort of getting resources. So we work with local countries, local country partners to address these issues. Currently, in whichever country we have been able to work on these strategies, the outcome has been that the several gaps have been fulfilled. But the key gap area, as you just mentioned, remains that majority of the persons with disabilities, especially with persons with print disabilities, do not have access, have been deprived of digital literacy for a very, very long time. We have created models. We are making huge efforts because the real solutions actually lie in adopting standards, building capacity for following those standards, in subsidizing the solutions that need to be there in the hands of users, the procurement policy, so that anything that government procures is accessible. So all these things put together will definitely make a difference. And I would like to just mention one of the efforts that realizing that there is a very small percentage of people who are getting access to these technologies. In India, for example, we got all the stakeholders together to create a strategy called See a Million strategy, where the holistic solution is to be delivered to at least 1 million persons in next 5 years. And this is the whole civil society, government, and industry getting together for the implementation of such strategies. So, so yes, there is a big digital divide, but solutions are there. There are very, very good models that we can share. But yes, the challenge of reaching out to the majority of persons who are currently being deprived because of the lack of awareness amongst the, not just amongst the users, but their parents, their teachers, and even the leaders of several organizations. The awareness is low, which has resulted in this digital divide being extended for a long time. Thank you so much, Kavit.
Thank you so much, Dipendra, for such an informative and enlightening presentation, specifically about the point concerning See a Million campaign. It's so important to build coalitions, build networks, and strive hard to find solutions. But it's quite easy to be bogged down by the idea of digital divide. Thank you. I really appreciate that. We will be asking questions more to the other panelists, but the most important thing right now is to pivot towards from the digital divide to inclusive education. And I would like to invite Joseph Murray to talk about learners with disabilities and how they are faring in these remote learning settings. And specifically, if you could reflect upon deaf and hard of hearing children and young adults at the school. How is the whole inclusive education process working in the COVID pandemic times? Joseph, the floor is yours.
Thank you. COVID-19 has impacted the lives of people all over the world. However, the consequences of this pandemic on the education of children with disabilities, including deaf children, were disastrous. Due to the imposed governmental lockdown measures, all educational settings had to switch to online education and not online inclusive education. Inclusive education is crucial to achieve the inclusion and participation of all persons with disabilities in their societies. Last year, IDA issued an Inclusive Education Global Report, which outlined 10 key recommendations for governments and civil society. A critical message of this report is that building a truly inclusive education system is the only way to achieve SDG 4 for all children, including children and youth with disabilities, whoever and wherever they are. Now, the second word, wherever, has taken on special relevance during the pandemic. While everyone around us is talking about building back better, it's worth taking some time to review the ad hoc remote and learning platforms developed in the midst of the pandemic. Were these designed in accordance with best practices for learners with disabilities? In some cases, yes, but in many cases, no. The World Federation of the Deaf has received concerning reports from a number of our 127 national members that deaf learners have not received full access to sign language-based education during the pandemic. Other IDA member organizations have also received similar concerning data. Children with intellectual disabilities and their caretakers need to be given support to do remote instruction. Online platforms may not be accessible to all learners in accordance with UDL principles, with, for example, sign languages and closed captions not being provided for deaf and hard of hearing learners, or visual materials not being made accessible for visually impaired learners. Inclusive education requires an educational transformation. Even before the pandemic, 50% of children with disabilities in low and middle income countries were out of school. The WFD estimates that less than 2% of deaf children in the world have access to a bilingual education in their national sign languages. There is a clear and urgent need to transform our education systems to ensure they are truly inclusive, including all learners with disabilities, learners from marginalized populations, and women and girls, among others. When building back, we need to keep universal design for learning principles front and center. IDA will be releasing a guidance document on UDL later this month, and many of the principles in this document are applicable for in-person and remote learning. Let's build on the lessons we are learning in this pandemic to ensure fully inclusive education systems going forward for all learners, whoever and wherever they may be. Thank you.
Thank you so much, Joseph, for talking about building back better and accentuating the need to have universal design from the get-go. You are kind of centering the idea which Jenny mentioned about accessibility by design. And it's so important to raise that from the beginning. Yes, so now I'll be asking a few follow-up questions, and I would invite all the participants who are following the proceedings thus far to ask more questions, specific questions to the speakers, whomsoever you want to ask. And I would be ensuring that those questions get answered as best as it could be possible, keeping in mind the time constraints. So my first follow-up question would be to Sonia. Sonia, you mentioned very emphatically about the barriers which deaf and blind community members are encountering during the COVID pandemic crisis. What, if any, are there any opportunities which have been created, some best practices, some things which have worked for the deaf-blind community during this COVID pandemic crisis for community inclusion and social participation? Sonia, the floor is yours.
For us, the deaf blind, there have been lots of problems. We haven't been able to participate in many events in general. We have felt excluded from participation in society. And now we are trying to find support so that our situation is taken into account. Our economic situation is also very complicated. Governments should make more efforts to support us, providing interpreters and making it easier for us to communicate in general. Then this would be a way to fight our isolation. Sometimes we can hear or see a little, but some other times we can't see or hear at all, and our problems are even bigger. Many children haven't had access to education, and some people who were working had to stop working because they couldn't continue doing it remotely. So we need more access to work, and we need cheaper devices or some support in order to get the adequate devices to continue working. We need more awareness raising, and we need support in terms of technology. Some people have relatives by their side, but some others don't. And those relatives need to go work as well, so they cannot support us all of the time. We need more caretakers, and governments should support us more at this respect. They should provide adequate resources for our situations. I hope I made myself clear. Thank you.
Thank you so much, Sonia, for reiterating the aspect of adequate resources and access to technology, which is cheap enough so that people have opportunities to participate in the labor market. And this straight away leads to my next follow-up question to Jenny concerning how is, Sonia mentioned about the role of the governments. How can partners such as Microsoft, who are leaders in the domain of corporate world, help in lowering these accessibility barriers, the resource constraint barriers, and provide technology which is cheap so that people like Sonia and the other disabled community members could participate in the labor market, feel included? Jenny, the floor is yours.
Yeah, I think it's a fantastic and the right question at these times. I do think that, you know, if you look at what is happening with the world of disability across all the sectors, we are seeing some enormous growth in some areas. And I think holistically, as we all know, just growth in the disability demographic and a decrease in societal inclusion. And really, this is the disability divide. It's what the World Bank coined, the disability divide. And we clearly believe that technology is a massive component to help solve some of that disability divide, on top of driving awareness, education, and also tackling the talent pipeline, the blockages that exist in the talent pipeline from education right the way through to employment. Technology has a massive part to play. And I think the good news in this is that the acceleration in accessible technology and the ability to render environments more accessible has become easier in so many ways, primarily due to artificial intelligence. And I think that's coming at the right time. However, I don't think the awareness of what people can do and how they can use that is there. And I think, as many others have called out, I think the cost factor, the availability of technology. So I think for us, I mean, there's some generalized principles which I think any accessibility nerd smiles and goes with on these things. Accessibility needs to be thought of right at the beginning of a development cycle. It needs to be embedded into the product. It needs to be easy to find, easy to download, and cost needs to be affordable or zero. And so, you know, there's really just grounding factors, I think, to this. The one that I think really epitomizes some of the opportunity here, for me at least, is Accessibility Checker. It's a simple feature that we have in all of Microsoft Office, the 60+ components of Microsoft Office, and it sits right next to spell check. So it's right there, you hit it, and it will tell you how accessible your document is and guide you on how to fix it, and use artificial intelligence to fix it in an automated way if you give it that approval. And what we're doing with things like that is we're making it running in the background. So it's notifying people, hey, your document may need a little bit of help. And actually in Outlook, we've turned it on now that you can't send an email to a large group of people without it prompting you and saying, hey, your email is not going to be accessible, please fix this. And so I think that is for us in many ways the lens that we really want going forward, is that it's not just on people with disabilities, it's on the world to be more inclusive of people with disabilities, and technology can really, it can power that. And so I get excited about the way forward, but I don't want to we've got a long journey ahead to tackle the disability divide.
That's such a fantastic point, that you mentioned, that we have a long journey when it comes to the inclusion for persons with disabilities. Also, how technology can be a game changer, a leveler, if you will, about we could provide products which are accessible and usable and affordable. So important. Thank you for your perspective, Jenny. Really appreciate it. So a question to Dipendra. Dipendra, you mentioned in the previous round about the See a Million campaign. If I would like to invite you to reflect upon how could we circumnavigate the challenges of digital divide. Are there some best practices other than that which you would want to accentuate and talk about, specifically in the developing country contexts? Because these technologies could be quite expensive. Thank you.
Yes,
The floor is yours.
and yes, and thank you for this question. Because affordability and compatibility to local language, I think, are the two biggest barriers in terms of access to the key assistive technology, which is essential for bridging this digital divide. And also responding to Sonia's concerns on this issue, that how can we bring down the cost? So yes, we can't simply pick up assistive technology from the high income group countries and paste them in the developing countries. That we do need to innovate. We do need to, put in a lot of efforts for developing technologies for this specific population that we are talking about. One of the good examples, one or two good examples that I can share with you is that we actually have worked in collaboration as I'm founder trustee of an organization called Saksham, and it has worked. One of the most reputed engineering colleges of India is called the Indian Institute of Technology, the IITs, and Saksham and IIT Delhi together have put together a special lab called AssessTech Lab, where at any one given point of time there are about 30 to 35 persons from various disciplines of engineering who are working together on building various solutions for persons with disabilities. And the prototypes that they develop then lead to development of startups in India. There are three which have already come out of the AssessTech Lab, and one of them is good news for Sonia, that there are these refreshable braille displays that have come up, which uses different technologies and are fully compatible with Indian languages and many languages of the world. And this has kind of brought the cost down to almost to the tune of about bringing it down to almost 1/6 to 1/7 of the cost that was earlier that we had to spend for these technologies. And so this is one example. The second one is that we built a robust. We are building a very robust distribution system. That's another huge gap area that exists. We've launched an online store especially for assistive technology, and even by bringing the cost down through manufacturing or innovation, when we are not able, there's still a large number of people who are economically challenged. Then we work on subsidy. So step by step, if I may say, we try to make things available at the most affordable cost, compatible with Indian languages. The second part is that even after such innovations, when things are not accessible or not affordable, we then bring in the concept of subsidy, whether it is through government programs, influencing the government policies, or through non-government programs through our corporate social responsibility pool that we dive into, and then bringing the cost down. And we ensure that the assistive technology is not delivered on its own, but along with the training and involving key stakeholders, that just giving a device an assistive technology to the user will not give it. It has to bring in, awareness and the training of the key stakeholders, such as the special educators, teachers, parents, employers, and so on and so forth, so that they really know the potential of what the solutions are, so that there is an early adaptations for such technologies. May I also highlight that fact that just the availability of technology and the solutions may not solve the whole problem, because this lack of awareness, lack of training will still hold us back, and we will still not be able to reach the million. So it's a whole multi-pronged approach with innovation, dissemination, training, support, all that put together, that will actually bring the whole solution to people.
Thank you, Dipendra, for such a wide-ranging answer. Appreciate it. Like now, before I ask the final follow-up question to Joe, I would like to invite all of you to reflect upon this question concerning the GDS, the Global Disability Summit, which will be happening in Norway in February 2022. So what, for all the participants around the globe, what do you think should be the single most important point which we as civil society should raise while we are preparing for the GDS 2022? I would like you to reflect upon it, perhaps share your perspectives, write them in the chat box. And in the meantime, I'll ask the final follow-up question to Joe. So, Joe, people have been talking about best practices, collaboration, and I would like to ask, in the domain of inclusive education, are you aware of any best practices which have emerged during the time of COVID pandemic crisis? And would like to share some of the perspectives. Floor is yours, Joseph.
Thank you. I'd also like to answer one of the questions in the chat, which I thought was extremely interesting. It was during the COVID pandemic, how did the CRPD committee work? So part of my answer to the question about education looks to the convention. So if governments understand their obligation in achieving what's in the CRPD, they must understand their obligation to inclusive education. The WFD has issued several position papers on best practices in the inclusive education of deaf learners. And we have issued new papers specifically addressing the situation of deaf learners during the pandemic in collaboration with our WFD youth section. What we have seen in several countries is that deaf students in congregated settings, bilingual sign language schools, have been able to continue education via virtual means because of the expertise these schools have developed in educating students bilingually. However, students relying on reasonable accommodation services have found themselves left behind in the transition to remote learning and online platforms. So deaf students in post-secondary settings have faced multiple challenges in getting access to an equal learning experience. The lessons here are that deaf learners, and indeed all learners with disabilities, should not be responsible for advocating for access after learning has started. Rather, those responsible for education need to ensure their remote and online learning environments are already built to be accessible to all learners. Going forward, governments and civil society I think we all want to build back better. And in order to do so, Governments and civil society actors should develop a comprehensive review of educational provisions during the pandemic. This review then needs to be done in close consultation with OPDs, learners with disabilities, and their families. And these reviews should take their starting point in the principles outlined in the IDA Global Report, the upcoming UDL guidance document that I referred to, and disability-specific position papers by the IDA's member organizations. This way, Building Back Better will not only be an inclusive process, it will also be a meaningful one that will help better equip us to meet new challenges going forward. Thank you.
Thank you, Joe, for these comments. Now we have a few questions from the audience, and I would try to wrap it up really fast. Jenny, this question, perhaps you might be good at answering. One of the persons is asking that, yes, accessibility from the beginning is important, but how do you ensure nothing about us without us? You have some perspectives on that?
Nothing about us without us, one of the most important phrases in the disability community. Yes, it is an incredibly, crucially important not just phrase, but really in many ways crucial to both physical and digital accessibility success. Ensuring the viewpoints of people with disabilities built into the fabric of whatever it is you're building at the right point, again, at the beginning, not at the end. Let's not remediate content. Let's not remediate. You wouldn't do that with a physical building. Why would we ever try to do that in the digital world? We wouldn't try and build a ramp the day before we opened it. We would absolutely make sure it was done at the beginning of that process. So I think it really is about making sure that we infuse the perspectives methodically, mechanically into the design. There's a few things that are really important to us here. One is, if you don't know if something's accessible, it's not. There is no in between. To make sure that you have the right scalable environment to get the right level of testing that you need to ensure that something works. Again, you would do that with the physical world. Let's do it better in the digital world. And I think the other element of really nothing about us without us is making sure that you have incredible listening vehicles. The one that really matters to us, we've actually had it now for 8 years, is our support channel, Disability Answer Desk, or DAD. I have a team called DAD. I don't have a mum team, but I have a DAD team. And we take around 15,000 calls a month into that team. It's a free service, French, Spanish, English, sign language, ASL. And we are able to help people with disabilities, with whatever, learning accessibility, learning what training there is, fixing problems if they happen. And also we get a wealth of input that helps us to build better. So just make sure you have it clearly in your design process and you have great listening vehicles to keep it good.
Thank you so much, Jenny. I'll have one quick question to Sonia before we wrap it up. Sonia, you mentioned about the community inclusion issues or the challenges. Was CRPD effective in the when it comes to the implementation during this COVID times? Did it work in the case of Ecuador and other African countries, which you were alluding to in your presentation? How would you assess that? Briefly, Sonia, appreciate your input.
Bueno, bien. Aquí en nuestro país.
Here in our country, we had support from many people. We tried to have some technology to help us, and interpreters have been paramount. But we don't all have access to them. this device you see here is $1,400 plus the shipping cost. And also there is a risk that this is not delivered. So as you see, it's not easy to get access to the devices. Some institutions have helped us, have provided support, but not for everyone. We are privileged, the ones who got it, but many others didn't have access to these devices, and we need to end this marginalization. We need our government in Ecuador to support us even more. We need support for the deaf blind, because deaf and blind have it easier, but the deaf blind are still missing a lot of support. And we need new policies, new laws to be included in the legal system. The deafblind need more legal presence and more support from institutions.
Thank you so much, Sonia, for reasserting the fact that legal recognition and new laws and implementing of the laws are so crucial for realizing comprehensive disability inclusion. Pardon me, we have run out of time. Thank you so much to all the speakers, Sonia, Jenny, Dipendra, Joe, for their contributions. Thanks to all the people who dropped the questions. I'm sorry we could not address it. As you know, in these thought-provoking discussions, time flies very quickly. So I would like to hand over now to the next session. It is titled Our Communities in Real Life, How We Could Live Independently in Communities. And it's being moderated by Mr. Alexander Cody. The floor is all yours. Thank you from me right now from Norway, sending across greetings.
Thank you, Gagan. Before we go to the next session, we will just have a quick 10-minute break, and then we will go to Alex's session. So we will be back in 10 minutes. Thank you.
Thank you very much, Tallinn, and thank you, Gagan Chabra and the speakers for the previous session. Welcome back for this session in real life about the right to live independently and being included in the community. As we heard, the isolation that many persons with disability, the population have experienced for the first time with COVID-19 crisis and the lockdown is actually a common situation for millions of people of persons with disabilities that are either stuck at home or in institutions far from community life, education, and work. We know from the CRPD committee that the right to live independently and be included in the community apply across the life cycle from childhood to old age. And that for that to be realized, there is a need of context relevant, age appropriate, and gender responsive support mechanism that foster choice and autonomy. We heard about the need for guide interpreter and assistive device, among many other support requirements in the previous session, all generating costs for persons with disabilities and their families. The COVID-19 crisis confirmed the limited capacities of most low and middle income countries in providing such support, with less than 20% of persons with significant disability accessing disability benefits and the quasi-inexistence of publicly funded support services. This leads to a fundamental reliance on families, which are supposed to cover most costs and provide support. But the COVID-19 also showed us the devastating impact of over-reliance on institutions in many higher income countries. And there are very legitimate concerns that the lasting socioeconomic and fiscal impact of the COVID-19 crisis will lead to austerity policies that might undermine existing support systems. We have with us three great speakers that will tell us more about the diversity of support required by people with disabilities across the life cycle and in different contexts, about the lesson they learned from the COVID-19 crisis and what it means for an inclusive recovery. We have with us Bhargavi Davar, Director of Transforming Community for Inclusion and founder of the Bapu Trust from India, Fatma Wangare, the Regional Coordinator of Inclusion Africa and Executive Officer of CAID in Kenya, and Adolf Ratzka, founder of the Independent Living Institute from Sweden. So I would like to start with Bhargavi. Bhargavi, welcome. You are both a tireless advocate for the rights of persons with disabilities, as well as a leader in innovative service provision for inclusion. You have been working to enable community to support persons with psychosocial disabilities in ways that are respectful of agency and dignity. More recently, you have initiated a deinstitutionalization project for women in psychiatric institutions. You told us about the terrible impact of COVID-19 and the lockdown on the poor urban communities where Bapu Trust is working. Can you tell us about the main challenges and the lesson learned that you have faced in trying to continue to provide support through the COVID-19 crisis? And could you tell us more about the kind of cooperation and support that took place with government mechanisms? Bhargavi, the floor is yours.
Thank you so much, Alex. I'm so happy to be here at the Civil Society Forum. We started in a low-income community population, urban poor, with 30,000 people a decade ago. We had great aspiration for a CRPD compliant community inclusion project for persons with psychosocial disabilities. Such a program would practice zero coercion. There would be no institutionalization and there would be no forced treatment for persons with psychosocial disabilities. It would make extensive human and other support systems available to persons with psychosocial disabilities, and all this would be available near their area of residence. This meant that we not only work with persons with disabilities, but we go very deep into the social fabric of our communities, engaging families and neighborhoods. We invented many practical modules to deliver on on support, and inclusion at the household as well as at the neighborhood level. We did not for a moment think that it is the state responsibility. And I remember having many hot policy debates on this, whether the government can support everything. Our learning is that such a program is possible and scalable. There needs to be 4 guiding strategies for inclusion to happen. Peer support, access to social capital in the neighborhoods, access to generic and specific services, including housing and nutrition, and multi-stakeholder dialogues within the community on humane crisis response. The project eventually scaled from 30,000 people to now approximately 800,000 people, being the largest inclusion program for persons with psychosocial disabilities in the Asia-Pacific region. Never once did we imagine that this was not our job as a DPO. This was really the job of the government. We did not get much support from the government. Inclusion is not within the policy framework of government, even though we have 2 new laws which talk about Article 19 in very specific terms. There is data to show that our small program prevented institutionalization of dozens of people over the years. We learned that creating community support systems in line with the CRPD was a specialization or a demarcated area of specific interventions. And this cannot be jumbled up within public health or rehabilitation. Actions within those are rather limited, and that the state is able to provide. It was with this confidence that we entered a program to deinstitutionalize and resettle women from the local mental institution into the open communities. 2 women who were settled in well before the pandemic thrived in the open, free environment with support of the existing inclusion program that we were running. Community life by the time the pandemic settled in, as we knew it, was devastated by immediate joblessness, abject poverty, hunger, starvation, and death. Along with a burnt out health system with minimal resources, no emergency care. Absent government support or very delayed responsiveness, the community support systems on which we heavily depended crumbled as families faced the harsh realities of lockdown. We have been advocating for DI since long, more so during the pandemic. 8 women received discharge and were settled in the wake of and after the pandemic began. All of them entered a second incarceration in their own homes due to the lockdown. Those who took the risk to enjoy their new liberation were severely affected by the virus with medical complications, and they had to be rushed into private emergency care as life-saving measure. We learned that such institutions have already caused unimaginable health compromises for its residents over the years. It is so difficult for a DPO with limited resources to be able to restore that level of health compromise in the wake of the pandemic. While in our DI program, we had covered a lot for self-care, life skilling, housing, employment, and overall well-being, we did not foresee the extraordinary cost of restoring health, bringing people back to a confidence level of daily decision-making and employment during the pandemic, where resources from the government were so poor. People deinstitutionalized need long-term community support, daily personal assistance, social protection package to cover for needs that go over and beyond what people with disabilities generally need and what is needed among the urban poor. Our small cash transfer policy provided by crowdsourcing funding was totally insufficient and no material supports were available from the government. Whereas from the inside the hospital, news spread that hundreds of persons were affected and several had died without adequate medical care. So the dilemma, whether inside or outside, our experiences must not lead to the inference at policy level that we must be cautious about DI. We face those situations because of absolutely no support whatsoever from policy. Policy must put faith on inclusion and back it up with budgets and program designs. And I think so, DI must in fact guide future policy in mental health, including and especially during COVID times. It should go beyond just liberalizing discharge procedures to get people quickly out of the institution and hand them over to communities without any preparation or any support. Thank you so much, Alex.
Thank you very much, Bhargavi, for this testimony. I think you articulate very well also a role of DPOs and civil society organization in spearheading social innovation, trying to find solutions with communities to support inclusion of persons with disabilities and working with persons with disabilities themselves to find what works best. But you also highlight the need for government support to scale up. You said a DPO cannot alone respond to this wide diversity of needs and need for support in different sectors, whether it's about community living or health. Thank you very much, Bhargavi, for that. We come now to the first open question to our participants and listeners around the world with regards to the preparation of the Global Disability Summit. So we would like you to answer the following question. What is needed in terms of capacity at the national and grassroots level to achieve effective CRPD implementation and the achievement that national government have made at the Global Disability 2022? Please type your answers in the chat box. Thanks a lot. So moving from India and the experience of Bhargavi and their organization and colleagues, I would like to go to Kenya and meet Fatma Wangari. Fatma, you have been working with children and adults with intellectual disabilities and their families for many years in a country and context where there is still little government support in terms of social protection or support services, which means that most support actually remain addressed by families. Can you tell us more about the work your organization have been doing with all those stakeholders to create yet support systems that actually foster choice and autonomy of persons with intellectual disabilities? And what is the role that you see for social protection and government support in developing services that would support living independently and being included in the community? Fatma, the floor is yours.
Thank you very much, Alex. Good morning, good afternoon, good evening. It is my pleasure to speak to you in this session. We all want to belong in our families, in our neighborhoods, in our local schools, in our local churches and mosques, in our leisure and recreational clubs, and in various spaces in our communities. But this is not the reality of so many people with intellectual disabilities in Kenya and in many other parts of the world. Our work is anchored on the principles of choice, personal autonomy, and meaningful participation and inclusion in all aspects of life in the community. And our work is informed by two very critical voices of our members. So the first voice is the voices of people with an intellectual disabilities, and here is the voices of adults with intellectual disabilities. And their question is always one: what will happen to us when our parents grow older, or they're elderly, or they're normal? We want the same as our peers, as our siblings, to have jobs, to have families, to have relationships, to go out and have fun like any other person. And then the second voice is the voice of families, and especially parents. And the question that parents always ask us is, what will happen to my son or daughter when I can no longer take care of them, or I'm no more? So our first anchor in our work is the role of family support networks. And we all know that in the absence of services and state-funded supports, majority of persons with intellectual disabilities or persons with disabilities generally depend on their families for lifelong support and care. So over the years and working with families, we strongly believe that families are pathways to meaningful participation and inclusion of persons with intellectual disabilities in their communities. I've seen this with my own daughter. If I wasn't empowered as a mother, she wouldn't be a strong self-advocate. So we therefore and continuously build the capacities of families on different aspects. So one of the aspects is, on deepening the understanding on the CRPD, the local laws, and advocacy. We also create networks or platforms where they can engage meaningfully with the local governments and other stakeholders in their community, and the need of them advocating for, inclusive services in their own communities. So some of the examples that we've seen over the years that families have been able to do and targeting, children with intellectual disabilities is that, family support networks have been able to mobilize themselves into groups, and together they've been able to advocate or open up even their own houses for rehabilitative and therapy services in their homes and communities. Another example is, looking at respite care and daycare. Families have been able to come together, and especially mothers, each working in turns, maybe 2 to 3 mothers, and taking care of children with intellectual disabilities while the rest of the mothers go to run errands or they go to work. And, just having that cognizant that, for many families, affording a nanny in Kenya is quite expensive, and especially when you have a child with a significant intellectual disability. Another key role that we really engage in, and this is the issue around, registration, we realize that quite a number of children and adults with intellectual disabilities are not registered at birth. They are not registered as, legal citizens when they attain the age of 18 and are not registered as voters, and therefore have no, they cannot vote on an equal basis with others. So we do a lot of work with the registration department to ensure that, they're registered across, different levels and different ages for them to be able to participate in their own community. We also work together with the National Council for Persons with Disabilities to ensure that children and adults with intellectual disabilities are registered as persons with disabilities in the country. So for the youth and adults, we have a very vibrant, we have 6 vibrant self-advocacy groups, and the self-advocacy groups are also peer support networks for people with intellectual disabilities. So we do a lot of trainings in the groups looking at, different aspects of community life. Some of the trainings include human rights training. We do a lot of training on financial literacy in collaboration with local banks. We work with local hospitals on trainings on sexual and reproductive health rights. We do trainings around decision-making, political participation, among other trainings. And some of the activities that the groups engage in, therefore, is awareness and sensitization in the communities. They do participate with other youth groups in their communities on cultural events, cleanup exercises, going out for social nights and participating in their religious activities. We've also seen, quite a number of adults with intellectual disabilities getting married in their communities, having their own families and holding jobs. We rely a lot on natural supports that we have developed over the years. This includes the local traders in the market, that local guy in the barber shop, that local, that lady in a neighborhood supermarket, who are peers to adults with intellectual disabilities, and they've grown in the same communities, probably went to the same schools, or they go to the same, religious activities. We have trained a pool of other people to support persons with intellectual disabilities in different spaces. So for example, we have trained, intermediaries to support people with intellectual disabilities who interface with the justice system. We have trained community health volunteers to support adults with intellectual disabilities, especially the ones who are seeking reproductive health services. We've trained, and we've started this work quite recently in training job coaches to support adults with an intellectual disability to engage in meaningful work and employment. So looking at social protection and its role towards supporting people with intellectual disabilities across life cycles, one of the things that we believe in is services alone will not enable the realization of the right to live and be included in the community. We need to see a complete transformation or reorganization of our communities to be more inclusive. So looking at different spaces, whether that is, in inclusive education, inclusive employment, in health, social political participation, or cultural aspects. And therefore, one of the roles that we really believe that social protection can do is to support disability-related costs across the life cycle for people with, disabilities to be able to participate meaningfully on an equal basis with others in the community. Thank you, Alex, back to you.
Thank you very much, Fatma, for this sharing this perspective and experience. I think you highlighted again the importance of diversity in terms of approach. I think you showed very importantly how to work with the system with birth registration, disability registration, development of disability allowance to support people, but also investing in person with disabilities themselves in terms of self-advocacy, and working with families and communities to learn how to support person with disability in a way that foster agency and choice. And it's not granted. We already have some question around that in the chat, but we will come back to it a bit later. Thanks a lot, Fatma. So we heard about India and we heard about Kenya, about person with psychosocial disabilities and person with intellectual disabilities. And I think this is a very important element because quite often in training and exchange, there was in the past this idea that living independently and being included in the community is more something for rich countries. And we have seen since the adoption of the CRPD, a change of awareness, a change of narrative, that living independently and being included in community is a universal right that is implemented in different ways. I would like to go now to Sweden and to Adolf Ratzka. Adolf, you have been a lifelong advocate for independent living movement. You are world famous, and you have witnessed and contributed to the emergence and development of the independent living movement, embodied in Article 19 of the CRPD. In your lifetime, you have seen significant changes in ways your countries and others provide support to persons with disabilities. The COVID-19 has brought to light again the significant issues of institutions, but also highlighted all the issues related to older persons with disabilities, and this combination of issues related to being an older person with disability and the issue of institutionalization. Overall, what do you think about the impact of the COVID-19 crisis and what it revealed, and this connection that we need to make between independent living and what is called healthy aging or getting older? Adolf, the floor is yours.
Thank you, Alex, and good morning, good afternoon, everybody. I'll answer your question, illustrating my answer with my own autobiography, if I may do so. Exactly next month, it will be 60 years that I'm disabled, that I use mechanical breathing aids, like the mask you see on my face, that I move around in an electric wheelchair, that I need help for getting up in the morning, going to the toilet, getting dressed. The first 5 years after contracting polio, I spent in hospitals. and residential institutions in Germany. I was medically stable, but there were no support services in the community. And my mother could not do this work. In 1966, I managed to get out of the institution with the help of personal assistance. I won a scholarship to study in California that included a budget for hiring fellow students to work as my personal assistants. Since then, I've lived in the community, earned a PhD, moved to Sweden, worked as a researcher, started a family, got involved in disability policy, founded several organizations, and so forth. I've had and still have a rich and rewarding life thanks to personal assistance. Personal assistance has been the foundation on which I built my life. Without personal assistance, living in an institution, I would have died decades ago. I consider myself a profoundly ordinary person. I have no special talents, but what is special about me is that I've had personal assistance all my adult life. That is sadly very special. Millions of people the world over could have similarly rich and rewarding lives, could realize their inborn potential if they had personal assistance. That is, direct payments from the government for buying assistance services from the provider of their choice. Or better yet, payments for hiring, training, and supervising the personal assistants themselves. It takes that degree of control to optimize the quality of one's assistance, to optimize the quality of one's life. Is this solution for everyone who needs help with the activities of daily living? How about persons with psychosocial and cognitive impairments, autism, dementia, with supported decision-making? Supported decision-making from relatives, friends, or trusted former assistants. Many in these groups could manage a life in the community without being a burden on their families. In Sweden, half of the personal assistance users belong to these groups or are children underage. In many countries, the alternatives to people with extensive assistance needs are either the family or an institution. Relying on the family is a ticking time bomb. Sooner or later, they'll get too old to work for you. Without a family, we must move into an institution, if there is one. These facilities have names such as care home, group home, or other euphemisms that distract from the fact that there are institutions. In the language of the CRPD, there are particular living arrangements and violate the convention. Whether for 2 or 200 inhabitants, as long as housing and services are bundled together in the same location, as long as you have no control over who is working for you, when, where, with what tasks and how, as long as the staff is shared by the inmates, you live in an institution. The general comment number 5 on Article 19 of the Convention is very clear about that. During the pandemic, sharing the staff has turned institutions into death traps in Sweden and elsewhere. At age 22, personal assistance got me out of institutions. At age 77, I worry about having to move back to an institution. My needs, interests, aspirations are the same. But a new government might take away the right to personal assistance from my age group and force me into an institution. The institutionalization of older citizens is still widely accepted. Human rights are still not for all ages. Thank you, Alex.
Thank you very much, Adolf, for this testimony. And indeed, I think what you highlight is this need, referring also to what Joseph was saying earlier, that person with disability, whether they are and wherever they are entitled to the relevant and appropriate support to live the life they want on equal basis with others. And I think you highlight also something which is important, is that money doesn't solve everything. Policy choice are also incredibly important. If after 65 you are not a person with disability anymore, and you are not entitled to the same support of person with disabilities because you are an old person, there may be money for institution, there might not be money for support services in the community. And it's not a question of actual resource, it's definitely often a question of policy choice. So we heard from all our speakers about the diversity of context, the diversity of persons with disabilities, and the importance to enable communities to support persons with disabilities to live independently and being included in the community, and the role of government in setting the framework and the infrastructure so that this is possible, financed, and sustainable across the life cycle. So we'll just make a quick pause. We have now our second open question of this session for our participants and listeners around the world with regards to the Global Disability Summit 2022. It's a very straightforward question. What do you want the Global Disability Summit 2022 to achieve? Please type your answer in the chat box. So I would like to come back to one of the questions that we got from Andrea, I believe from Colombia. This question is to Fatma. You talked about the fears and the question that parents have, and it refers also to what Adolf said, the over-reliance on families is a ticking time bomb. The question you ask when parents says, what happened after me? What do I do when I die? Who will support my daughter or my son, which by that time will be adults, but still need support? So how do you address those fear and concern, especially with regards to recognition of universal legal capacity and elimination of guardianship, which goes hand in hand with Article 19 realization and living independently in the community? Andrea was mentioning that while guardianship was eliminated in 2019 in Colombia, there was strong opposition from some families of persons with intellectual disabilities. Could you tell us a little bit about how to address those fears and concerns? Fatma, the floor is yours.
Yeah, thank you, Alex. I will base the answers to the context that I am in. And one of the things that we've tried to do over and over again over the years is to address the fears that families do have. And that's why we invest so much in the social capital of, you know, families and communities and other stakeholders in this conversation, because we know there's over-reliance to families. And therefore we need to, you know, make this conversation like a community conversation, ensuring that people understand issues around legal capacity, supported decision-making. How do you support people with, you know, intellectual disabilities to make big decisions, small decisions? I think this is very, very important. And more important is to start those conversations with families when, you know, their children are still very, very young. Because I know, like in some of the work that we do and looking at, you know, cash transfer that is given to households, families have started having those conversations that, you know, here is the money on the table. This is the cash transfer that we've received. How do we plan for this money involving, you know, the person with an intellectual disability in that household? And again, when we talk about, you know, independent living, this scares a lot of families. And I think we need to start having, you know, deeper conversations. Are we really talking about, you know, independent living, or we are saying, okay, people have choices to live alone if they want, with supports, you know, and personal autonomy. But what we are really saying is that, you know, we are all interdependent. I might want to live alone, but I don't want to be lonely. I want to, you know, to be part of my community. So it's a very complex position to be in, but what I've learned over the years that we need to start addressing the fears with families when the children or when persons with intellectual disabilities are still very, very young. And again, invest so much in, you know, self-advocacy movements, not really bashing or fighting families, but just having, you know, that common understanding that, you know, my son or daughter has rights, they have right to make decision, and I might not be that person to support my son or daughter to make that decision. I am, you know, I am open to any other person within the community to be that person to support my son or daughter, as long as, you know, the safeguards are there to ensure that, you know, there is no violation in terms of, you know, the decisions being made. I don't know if I've responded to you. The question, back to you, Alex.
Thank you very much, Fatma. Indeed, I think one of the challenges we've seen repeatedly across context is the reluctance to believe that inclusion is possible. The challenge to believe that support can be available in the community. And this is where government intervention, setting up publicly funded systems, financing organization of persons with disabilities and families to build this infrastructure in the community is so important. I would like to go back to Bhargavi. Bhargavi, you identified multiple elements that were really relevant. I would like to see, there is so many things to do. We have the Global Disability Summit coming in 2022. What for you, with regards to what you learned from COVID-19, all the work you have been doing, what would you make a priority? Among all the things you believe needs to be done to ensure the right to live independently and be included in the community, what would you put forward if there was one thing you could, among many others? Bhargavi?
Thank you, Alex, for that question. As you said, there is a lot to be said in the context of GDS 2022. But I would go for just saying inclusion as a very concrete and practical policy matter. To a large extent, you know, whether it's Fatma's experiences or adults' experiences or our experiences in Pune, inclusion is considered as a very abstract value and something that people naturally do. in community. So policymakers, government, they don't really care too much about it. And of course, you know, with the CRPD, it is a human right, and policymakers must first recognize it as a implementable, feasible, possible human right. Community support systems, there are by now so many examples that community support systems can be built up, whatever the context, whether it's a global North context or whether it's a global South context. And governments need to recognize this idea that for inclusion to happen, they must come in with packages. For example, social protection and housing support is so much needed. Supporting families, the point that Fatma has been making, I think families is very important for everyone, but definitely for a lot of community members in the global South where we work, in India where we work, in Asia Pacific region where we work, with all the mixed feelings towards families. But I think that it's considered as a very important element, and governments do not support families and neighborhood development in any way at all. And so I think this is so important, inclusion in policies, removing laws that create new barriers to persons with disabilities. For example, legal capacity laws or institutionalization on the basis of disability continue to exist. There must be some moratorium on such legal provisions and practices. And I would definitely put my priority on social protection, cash transfers, housing, and employment. Thank you.
Thank you very much. Thank you very much, Bhargavi. I think you highlight a very important point, which also reinforced Fatma's perspective on how do we support family and community to support persons with disabilities, ensuring choice and control. And how do we balance those elements? We know that in many low and middle income countries, families will remain a core element of support for most people with disabilities. But how do we foster this independent living perspective, this choice and this autonomy? Thank you also for this focus on social protection, which is very timely in the COVID-19 crisis conversation. Fatma, up to you. What is for you the top priority? What would you like to see tackled in the Global Disability Summit 2022 to ensure that the recovery from COVID-19 will contribute to the right to live independently and be included in the community? Fatma?
Thank you very much, Alex. I see, and my comments looks at quite a number of issues. Just listening to what our members say. First, issues around inclusive education, especially in the global South. We are still lagging behind, and therefore we want to see more commitments from government to ensure that learners with disabilities are not left behind. We totally know that during COVID-19 pandemic, many learners with disabilities were not really targeted with, digital platforms when it came to, education. Number two is, around employment and reaching out to groups of people with disabilities who are underrepresented. How do we start having those, concrete conversations and ensuring that, they're supported to have meaningful employment in their communities with supports and accommodations provided. And for me, which is very close to my heart, is the role of families, and families need to be supported in their caring role. Without that, then, many groups of people with disabilities, especially in the global South, will completely continue to be hidden and forgotten in their own households. And finally, as I conclude, I think we also want, concrete steps to see, meaningful participation or inclusion of people with disabilities and their families in conversations around development in our countries. Thank you very much, Alex.
Thank you very much, Fatma, for those concluding words on your side. Again, also this importance when we consider Article 19, we have choice, 19B support, but also 19C ensuring that everything else is inclusive, and you emphasize education. If we want parents of children with disability to believe in inclusion, it starts also in education. Thanks a lot. Adolphe, I don't know if it's because you're the senior, but you have the privilege of being the last to speak. What are the main lessons learned from you from the COVID-19 going forward, and what you would like the Global Disability Summit to address, or at least the message you would send to them? Adolphe?
Thank you, Alex. From my perspective, the lessons from the pandemic are that we have to open up society to all people, so that society can welcome everybody. And that means, from my perspective, we need to develop support services in the community for the whole life cycle. Everybody, children, adults, older people. Services that are based not on need, are services that are based on need and not on diagnosis, on the person's preferences and not on the person's age, so that no one becomes a burden on the families. No one needs to move to an institution. We also need to increase the supply of barrier-free housing. Nobody should need to move into an institution because of lack of accessible housing in the community. And then, after we've done that, we can phase out residential institutions where we risk to be neglected, abused, and to die during pandemics. Yeah, I'd love to contribute to this work with my experience. Thank you.
Thank you very much, Adolphe. I'm sure you will. Thank you very much to all the speakers. I think you highlighted again this importance of building support across the life cycle, articulating different sectors. Adolphe, both you and Bhargavi mentioned housing, and we know how important it is. And I think you said, Adolphe, something very important. Nobody should have to move to institution. Having the choice means I can live in the community, and I have the support to do so wherever I am and whoever I am. Thank you very much, all of you, for this contribution. Thank you for your questions and participation. I will hand now the floor to Jose Fierra to conclude. Jose, the floor is yours.
Thank you, Alex. Good morning, good afternoon, good evening, everyone. Let me first say that I think we can celebrate once again the possibility of meeting together as a movement to discuss not only what we want from governments, multilateral agencies, other civil society organizations, but also to say to the global community what we can contribute with, what we are willing to take a leading role in shaping our future. Listening to all the great presentations that we have heard today, it is loud and clear that there is still a lot to be done. It is true that looking back, good achievements have been made, but at the same time, those achievements that mostly happen at the global level still need to be translated into real action at the national and subnational level. I really want to start by, first of all, avoiding making a summary of what has been discussed because I think you have all paid special attentions to all the speakers, but rather share with you at least what is my takeaway from this meeting. And I hope at least some of those takeaways are also what you will take with you after this civil society forum. The pandemic has actually not tell us anything new to us, but it reminds us of the extremely difficult situations many people with disabilities experience. Of course, the pandemic didn't tell us nothing that we didn't know, but in a way, it showcased to governments, private sector companies, private foundations, multilateral agencies, all the challenges that people with disabilities face. From the consequences of being in an institutionalization settings, to the lack of access to inclusive and accessible information. The pandemic has shown us the critically important components of people with disabilities' lives when it comes to employment, social protection, inclusive education, living in the community, etc. At the same time, many of the measures put in place by governments as response to the pandemic have not even been inclusive of people with disabilities. And once again, they have shown that we have been left behind. Listening to the speakers, now we have enough evidence to conclude that definitely something has to change in the near future if we want to make sure that people with disabilities are included. But at the same time as I'm describing this, there are also some good news. The first good news for me is that we are now more aware of what our problems are. But the good news is actually that we now have more tools to advocate for our rights. We know that our companies, organizations out there that are already thinking about persons with disabilities, and they are trying to make their services, platforms, etc., more inclusive of persons with disabilities. So although communication through online platform remains a challenge for many of the 1 billion people living with disabilities, there are also some good progresses made, and we also have to celebrate that. For me, the last session of this Civil Society Forum has once again played a unique role. And I really want to quote again our dearest colleague, Adolf, when he said, "We cannot be sent to institution because we don't have accessible housing." I can actually use those words and also apply them to that we cannot be excluded of education because there is no inclusive education systems in place. We cannot be excluded from employment because we don't have reasonable accommodations in the workplace. So Adolf, thank you for such a strong quote, but also thank you for sharing a quote that is applicable to many of our daily experiences as persons with disabilities. But there are for me two more things that this Civil Society Forum is allowing us to have with us. The first thing is that we now have the next Global Disability Summit. And it's again an opportunity to highlight how we want the international agenda around people with disabilities to look like. We have the opportunity to say, and actually we have started this right to meaningful participate today when responding to the questions that have been posed throughout the whole civil society forum. And some of the results that, of course, we will be publishing shortly a more detailed report of those questions, but some of the results are already helping us to define the roadmap towards the next Global Disability Summit. Just to mention a few, 40% of the people responded that they were not fully engaged in the implementation of the commitments from London. Only 4% of the people responding said that they participated somehow in the commitments made from London. Last but not least, 3% of the people who responded say that their governments know about their organization and try to engage with their organizations. So this is definitely something that can be improved, but the way that can be improved is to promote the rights of people with disabilities, to further engage with organizations of persons with disabilities, and from the disability movement side, and this is the other point that I wanted to raise today, is that the International Disability Alliance has created what I believe would be one of the most powerful advocacy tool in the next decade, and that is the global survey on DPOs. Because that survey is not only from a technology point of view, a great advancement in terms of inclusion and accessibility, but at the same time is the opportunity to share with our constituencies who we are, where we live, what we need, and above all, how we can contribute to improve our society. Once again, thanks everyone for joining. There is a lot to be done, but there is also a lot to celebrate for. Let's enjoy the next Conference of State Parties. Let's remain in contact, and let's remind that it's our responsibility to change the way people with disabilities are included. Thank you very much, and we then adjourn the Civil Society Forum. Thank you.